So now, after we heard the overview of the health tech sector in Israel, we are honored to have with us one real example on how a solution can solve those challenges. I am pleased to introduce Mr. Guy Benjamin, co-CEO and co-founder of the company Healthee, to introduce the solution and the company and why and how it is relevant to global insurance companies. Guy, floor is yours.
Thank you. So I'm Guy, the CEO of Healthee. After 13 years in the Israeli Air Force as a fighter pilot, I moved to the US. And after 2 years at Yale, I started working at McKinsey, the consulting firm. While I was at McKinsey, I quickly realized that I have no clue about my health benefits. Every time I have a question, I get sent to a call center. I'm spending much more money than I should be, and I'm just not a smart consumer. And that's what got me and my partners to really think about the need of technology in the whole world of health and wellness benefits. And that's what got us to start Healthee. And Healthee is really the benefit experience that us, our employees, our users really deserve. There's a saying that health benefits are simple, easy to navigate, and affordable. And I think we all know that this is an exact quote by no one ever. It's the exact opposite. It's a sea of confusion and a huge source of waste. But also, healthcare costs are just increasing year over year. And if we don't do anything about it, they're just going to keep increasing. We're going to see wasted benefits and a really poor employee experience. Because today, our users, our employees are being sent to multiple locations for all their healthcare needs. They're sent to call centers, they're sent to multiple platforms because they need to choose a plan during open enrollment, know what they're covered for, find providers, know their deductibles, and many other areas. But we said, let's build a platform, a technology that has all of it in one place, where employees can come in and choose the best plan for them and their family, know what they're covered for, find doctors, book appointment, talk to doctors, know how much things are going to cost, and on top of all of that, have their own personal health assistant, an AI-based platform called Zoe that becomes their digital front door for all their health and wellness needs. And how does it work? Well, Zoe knows how to take any health plan. It doesn't matter if you have Blue Cross Blue Shield, United, Cigna, any of the 900 carriers out there in the US, medical, dental, vision, EAPs, point solutions, and convert them using AI from an unstructured data source to a structured and mapped database. And once that happens, that's when Zoe becomes that digital front door. That's when she can answer any question about your health benefits. So for example, I can ask Zoe, hey Zoe, is my daughter covered for a speech therapist? She'll tell me if I'm covered for it, where can I get it done, how much each location gonna cost me, and book me an appointment and make sure that I got billed correctly. She's also proactive, so she'll let me know that it's time to get my yearly physical or skin test or anything that has to do with more on the preventive side. So I'll show you how it works. The platform, as you can see, it's accessible either your phone or your computer, and everything here is accessible, is a click or two away. Meaning if I have a coverage question, if I need to find a doctor, even urgent care, Zoe can show me the nearest urgent care facilities that I'm covered for under my plan. I can see here my deductibles, like a live feed of it. I can talk to doctors. I can see all of those point solutions that my employer provides me on top of my insurance. She even builds me my own wellness tracker for the year, my preventive plan for all the benefits that all the wellness benefits that I need to worry about during the year. And not only know about them, but I can actually go and find providers, book appointments in network, and make sure that I follow these preventive care. So in this example, Zoe just found me the nearest primary care physician. She'll show me their name, reviews, where they're located, and I can literally book an appointment for next week. And now it's booked, it's on my calendar, Zoe remind me of it. But if I do have a question, I can always go to Zoe and ask any question I want about my health benefits. I don't need to know insurance language or medical language. I can literally type as simple as, I have back pains. And what Zoe will do first, she'll go back to my health plan and make sure that she shows me all of the relevant information that I need to know what I'm covered for back pains. In this case, it's acupuncture, chiropractor, telehealth, MRI, even point solutions like a digital MSK or Sword Health. They're all here instantly. Now, let's say I talk to a doctor and they ask me to go get an MRI. I can click on MRI and immediately see the coverage for an MRI, in versus out of network. I can see that I need a prior authorization. She can even explain what is deductible, what is out of pocket. But then the obvious next step is to go find an MRI. So I can click on services search, and Zoe will now go and find for me all of the MRI facilities that are covered under my network in my area. So she'll show me their name, their reviews, how much they cost, and I can be a much smarter consumer within the platform. So you can see that the closest location for me is Teaneck, about 10 miles away, $26 based on my deductibles, and $258 the claims data. But if I keep scrolling down, or if I change this to price high to low, you can see that prices are all over the place. So without us being smarter consumers, we can, by accident, go to these locations that are costing $900 or $1,500 instead of the actual location where we should go, which is more closer to $200. I can even tell Zoe, hey Zoe, I want to find a cardiologist. And what she'll do first is she'll go back to my plan and show me, first of all, that I have coverage for a cardiologist. She'll show me that that as long as I stay in network, it's going to cost me $50 copay. And then I can just look for doctors. I'll just put in my office location in New York. And then she'll show me all the nearest cardiologists that are, again, in network. She'll show me their reviews, where they are, their specialties. I can even filter by language, for example. Let's find Hebrew-speaking doctors. I can filter by gender. I can filter by who's accepting new patients. And then book an appointment straight from here. Now, there's many other features of Zoe, and she's also helping me there in open enrollment. She'll show me what's the best plan for myself and my family. She'll help me choose my medical plan, my dental plan, my vision plan. And again, it's all in one place, so employees don't have to go anywhere else. And I can see it based on two main factors: cost, how much will each plan cost me, and coverage, which of the doctors that I usually go to are covered under each plan. She'll also build these financial scenarios to tell me under each plan, how much can I expect to spend on healthcare if I'm healthy, if I have a catastrophic event, or if I'm just thinking about a surgery or having another baby. And then lastly, she also tracks every information around what employees or users are asking, what benefits they care about. So it really gives me that sense of knowing what my employees or my users really need. And that can really affect my benefit strategy, especially because I get information not only about claims, but also about things that I may not cover. Lastly, what we're seeing are a result that speaks for themselves. We're seeing anywhere between 4 to 14% reduction on claim costs because we steer employees to lower cost option. We steer them to in-network. We steer them to telehealth. We see more benefit engagement because we now have employees know what they're covered for, know their benefits. We also save out of pocket anywhere between $1,000 to $2,000 a year per employee. Today we work with either direct to employers, brokers, carriers, partners like POs and TPAs, seeing a lot of demand for the platform and great results so far. So thank you so much for the time, and please feel free to reach out. I'm at guy@healthee.co. It was a pleasure being here.
Thank you. Thank you very much, Guy, and thank you, Zoe, for introducing us such a wonderful technology and solutions.